This video is focused on NMC competence test part 1, which is a computer based test called the CBT, which is intended for nurses who are trained outside the European Union and for those who are seeking employment as a nurse in the UK. And before going towards the video, if you find this useful, please share with your friends and also subscribe. And here we go. Before starting with, I have a request. Take it as a challenge. Make no mistake. It is not a matter to be taken lightly, and please do note down your scores. As you know, it is a multiple choice question. You have to pick the right answer. The first question is, what is the purpose of the NMC Code? The options given are: option number 1, it outlines specific task or clinical procedures. Second one, it ascertains in detail a nurse or midwife's clinical expertise. Third, it is a tool for educating prospective nurses and midwives. Option number 3 is the right answer. It's a tool for educating prospective nurses and midwives. Hope you have got the first answer right. Moving on to the second one, when do you gain consent from a patient and consider it valid? First option, only if a patient has the mental capacity to give consent. Second, only before a clinical procedure. And third is none of the above. Obviously, the answer will be the first one, because only if a patient has a mental capacity to give consent, we can gain consent from a patient and consider it valid. So that was a pretty easy one. Moving on to the third question, at what stage of the nursing process does the revision of the care plan occur? First option, assessment. Second, planning. Third, implementation. And fourth, evaluation. Certainly, evaluation is the answer. During evaluation, the revision of the care plan occurs. Fourth question, you can delegate medication administration to a student if option 1, the student was assessed as competent. Option 2, only under close direct supervision. Option 3, the patient has only oral medication. The right answer is, you can delegate medication administration to a student only under close direct supervision. Option number 2 is the right answer. So next question, a patient recently admitted to hospital requesting to self-administer the medication has been assessed for suitability at level 2. This means that option 1, the registrant is responsible for the safe storage of the medicinal products and the supervision of the administration process, ensuring the patient understands the medicinal product being administered. Option 2 is, the patient accepts full responsibility for the storage and administration of the medicinal products. Option 3 is none of the above. The registrant is responsible for the safe storage of the medicinal products. At administration time, the patient will ask the registrant to open the cabinet. The patient will then self-administer the medicine under the supervision of the registrant. So that's going to be the right answer. Hope you have got it right. Well, the next question, in a patient with hourly monitoring, when does a nurse formally document the monitoring? Option A, every hour. Option B, when there are significant changes to the patient's condition. And option 3, at the end of the shift. It is very clear in the question itself, it is an hourly monitoring. So the answer is definitely going to be every hour. That is, option 1 is the right answer. Next question, what is primary care? Option 1, the accident and emergency room. Option B, GP practices, dental practices, community pharmacies and high street optometrists. Option C, first aid provided on the street. The answer is going to be GP practice, dental practices, community pharmacies and high street optometrists can be the answer to what is primary care. That is option B. Next question, what infection control steps should not be taken in a patient with diarrhea caused by Clostridium difficile, that is C. difficile? Option A, isolation of the patient. Option B, all staff must wear aprons and gloves while attending the patient. Option C, all staff will be required to wash their hands before and after contact with the patient, their bed linen and soiled items. Option D, oral administration of metronidazole, vancomycin, fidaxomicin may be required. And option D, none of the above. Option D, none of the above. Next question, Independent advocacy is option A, providing general advice, option B, making decisions for someone, option C, care and support work, option D, agreeing with everything a person says and doing anything a person asks you to do, and option D, none of the above. Option D, none of the above is the right answer. Next question, which of the following are not signs of a speed shock? Option A, flushed face, option B, headache and dizziness, option C, tachycardia and fall in blood pressure, option D, peripheral edema. Peripheral edema is the right answer. It is not a sign of a speed shock. Next question, recommended pre-operative fasting times are option A, 2 to 4 hours, option B, 6 to 12 hours, and option C, 12 to 14 hours. 6 to 12 hours, that is option B is the right answer. Next question, compassion in practice. The culture of compassionate care encompasses option A, care, compassion, competence, communication, courage, commitment. Department of Health, compassion in practice. Option B, care, compassion and competence. Option 3, competence, communication and courage, and option D, care, courage and commitment. Option A is the right answer because the compassion in practice is a vision based on 6 values. It is also called the 6 C's. So right answer is option A. Next tricky question, hospital discharge planning for a patient should start option A, when the patient is medically fit, option B, on the admission assessment, and option C, when transport is available. Option B, on the admission. Next question is examples of offensive hygiene waste which may be sent for energy recovery at energy from waste facilities can include stoma or catheter bags, the management of waste from health, social and personal care, Royal College of Nursing. Option B, unused non-cytotoxic or cytostatic medicines in original packing. Option C, used sharps from treatment using cytotoxic or cytostatic medicines, and option D, empty medicine bottles. Option A is the right answer. Next is an easy question. Patient usually urinates at night. Nurse identifies this as option A, polyuria, option B, oliguria, and option C, dysuria, and option D, nocturia. Option D, nocturia is the right answer. Next question, an overall risk of malnutrition of 2 or higher signifies option A, low risk of malnutrition, option B, medium risk of malnutrition, and option C, high risk of malnutrition. Option C is the right answer. Next question, the signs and symptoms of ectopic pregnancy are except option A, vaginal bleeding, option B, positive pregnancy test, option C, shoulder tip pain, option D, protein excretion exceeds 2 grams per day. Protein excretion exceeds 2 grams per day is the right answer, that is option D. Next question, the use of an alcohol based hand rub for decontamination of hands before and after direct contact with patient and clinical care is recommended when option A, hands are visibly soiled, option B, caring for patients with vomiting or diarrheal illness regardless of whether or not gloves have been worn, and option C, immediately after contact with body fluids, mucous membranes and non-intact skin. Option C is the right answer, that is immediately after contact with body fluids, mucous membranes and non-intact skin. Next question, in DVT, death stockings affect circulation by option A, increasing blood flow velocity in the legs by compression of the deep vein system or thromboembolism deterrent hose, that is the TED hose, and option B is decreasing blood flow velocity in legs by compression of the deep venous system. So in DVT, TED stockings is used to increase blood flow velocity in the legs. So option A is the right answer. Next question is, what medications would most likely increase the risk for fall? Option A, loop diuretic, option B hypnotics, option C beta blockers, and option D NSAIDs. Option B is the right answer, that is hypnotics. Hypnotics is commonly known as sleeping pills. It is used to induce sleep, so definitely it can increase the risk for fall. So option B is the right answer. Next question. Causes of diarrhea in Clostridium difficile are option A ulcerative colitis, option B Hashimoto's disease, option C pseudomembranous colitis, and option D Crohn's disease. Option C pseudomembranous colitis is the right answer. Next question. What do you expect to manifest with fluid volume deficit? Option A low pulse low BP, option B high pulse high BP, option C high pulse low BP, and option D low pulse high BP. Option C high pulse low BP is the right answer. Next question. Wound care management plan should be done with what type of wound? Option A complex wound, option B infected wound, and option C any type of wound. Any type of wound is the right answer. Option C is the right choice. Next question. Wound proliferation starts after option A 1 to 5 days, option B 3 to 24 days, and option C 24 days. Option B 3 to 24 days. That is, wound proliferation or the wound healing starts after between 3 and 20. Well, coming to the final question of the session, barrier nursing for C. difficile patient, what should you not do? Option A use of hand gel or alcohol rub, option B use gloves, option C patient has his own set of washers, option D strict disinfection of patient's room after isolation. Option A, that is use of hand gel or alcohol rub, is the right answer. Question is, what should you not do? So friends, thank you for watching so long, and if this has been particularly useful for you, please do give me your comments and also hit the like button so that it motivates me to post the next session of the mock test. Thank you so much. Bye bye.